Hello dear students, my name is Barlas Aytacoglu and I'm a professor of cardiovascular surgery, and this year in International Cyprus University I will be with you with a lesson coded NURSE311 Health Promotion. I have been with students in the classroom face to face, and we have done 2 lessons up till now. This recording will be a repetition of the lessons that we have gone through for those who were in the classroom, and it will be almost exactly the same lesson for those who will be following us online. With this, I will be handing you the slides in so that you can reopen or rewatch the video and study for your lessons. I will also upload a presentation form of the slides to the Moodle system from where you can download and study again and again. I hope you will like this lesson. Let's get started. Okay. Health promotion, how do we explain it? What do we mean with health promotion? First of all, we're going to see the concepts. The process of enabling people to increase control over and to improve their health. This is what aimed for with health promotion. To reach a state of complete physical, mental and social well-being, an individual or group must be able to identify and to realize aspirations, to satisfy needs, and to change or cope with the environment. Health is therefore seen as a resource for everyday life, not the objective of living. Health is a positive concept emphasizing social and personal resources as well as physical capacities. Therefore, health promotion is not just the responsibility of the health sector, but it goes beyond healthy lifestyles to well-being all the time. The first publication of health promotion is from the 1974 Lalonde report from the government of Canada. This gentleman was the Minister of Health in the government of Canada in 1974. It proposed the concept of the health field, identifying 2 main health-related objectives: the health care system and prevention of health problems and promotion of good health. The report is considered the first modern government document in the Western world to acknowledge that our emphasis upon a biomedical healthcare system is wrong, and that we need to look beyond the traditional healthcare, or in parentheses, sick care system, if we wish to improve the health of the public. So the system itself was called the sick system with the Lalonde report because doctors and nurses always focused on treating the patients after becoming sick, and this report forwarded that we should go beyond it and we should bring people to a state that they will not be sick, or we should prevent them becoming sick. So that system that deals with the patients after being sick is the sick system. For a healthier system, we need to promote this. The report also recognizes that use of the local health system shapes how people define their health-related need, options for care, and definition of health. So Mark Lalonde, who was the Canadian Minister of National Health and Welfare in 1974, proposed a new health field concept as distinct from medical care. So health field consisted of biology, environment, lifestyle, healthcare organization. If we look at biology, all aspects of health, physical and mental, developed within the human body as influenced by genetic makeup. And when we look at the environment, all matters related to health external to the human body over which the individual has little or no control, including the physical and social environment. Lifestyle, the aggregation of personal decisions over which the individual has control that can be said to contribute to or cause illness or death. And healthcare organization includes medical practice, nursing, hospitals, nursing homes, medical drugs, public health services, paramedic services, dental treatment, and other health services. So health promotion and disease prevention programs can empower individuals to make healthier choices and reduce their risk of disease and disability. At the population level, they can eliminate health disparities, improve quality of life, and improve the availability of healthcare and related services. Health promotion is about raising the health status of individuals and finally, ultimately, the communities. Promotion in the health context means improving, advancing, supporting, encouraging, and placing health higher on personal and public agendas. Given that major socioeconomic determinants of health are often outside individual or even collective control, a fundamental aspect of health promotion is that aims to empower people to have more control over aspects of their lives that affect their health. These twin elements of improving health and having more control over it are fundamental to the aims and processes of health promotion. So in definition, health promotion is the process of enabling people to increase control over and to improve their health. It moves beyond a focus on individual behavior towards a wide range of social and environmental interventions. It is a positive concept emphasizing personal, social, political, and institutional resources as well as physical capacities. This is described in World Health Organization Charter in 1990. Health promotion is any combination of health, education, economic, political, spiritual, or organizational initiative to bring about positive attitudinal, behavioral, social, or environmental changes conducive to improving the health of population. Health promotion is directed towards action on the determinants or causes of health. Health promotion, therefore, requires a close cooperation of sectors beyond health services, reflecting the diversity of conditions which influence health. Government at both local and national levels has a unique responsibility to act appropriately and in timely way to ensure that the total environment, which is beyond the control of individuals and groups, is conducive to health. So if we look at this slide here, we can see that we have health education, health protection, and prevention as a model of health promotion, and they all have significant interactions with each other for the benefit of the communities and in the end for people themselves. So health education is a process which informs, motivates, and helps people to adopt and maintain healthy practices and lifestyles. It advocates environmental changes as needed to facilitate this goal and conducts professional training and research to the same end. Health protection is the branch of public health concerned with policies and practice to improve the prevention and control of diseases and other environmental threats to the health of the population. And disease prevention covers measures not only to prevent the occurrence of diseases, such as risk factor reduction, but also to arrest its progress and reduce its consequences once it has been established. So if we look at this slide here, and these are the determinants of health, we have risk factors, health promotion, and risk conditions. With health education and healthy public policies, we bring about we increase the individual capacities to consciousness raising, education, motivation, and skill building. And with environmental supports, we raise rules, regulations, and guidelines, facilities and services, social support incentives, and all together they bring us to health literacy, health knowledge, beliefs and practices, capacity and self-efficacy, and community empowerment, which then goes to changed health behavior and practices within the communities, therefore reaching to improved health outcomes and reduced inequities. Inequity is one of the aims of health promotion, and we will be talking about health inequities more as we carry on with our lesson. Health education versus health promotion. What is the difference? Health education involves giving information and teaching individuals and communities how to achieve better health. Health education seeks to motivate individuals to accept the process of behavioral change through directly influencing their values, beliefs, and attitude systems. In contrast, health promotion involves social, economic, and political change to ensure the environment is conducive to health. The two concepts, health education and health promotion, are symbiotic strategies. This means that they are closely associated or related and that they benefit from each other. In the case of health education, most activity centers provide learning opportunities for individuals and communities so that they are able to voluntarily change their behavior. In other words, they acquire information and skills to help them initiate a change that enhances their well-being and their health. Health promotion activity is much broader and includes health education, the provision of preventive health services, measures to protect the physical environment and make it conducive to health, the mobilization of community resources, the implementation of organizational policies which promote health, and economic and regulatory activities. So as seen from here, we can see that health promotion is like an umbrella covering all economic, regulatory activities, preventive health sciences, health education, community-based work, organizational development, public policies, environmental health. So many things are under the umbrella of health promotion. A key feature that distinguishes health promotion from health education is that health promotion involves environmental and political action. Similarly, it is possible to distill the concept of health promotion into an essential formula, which is health promotion is equals to health education times healthy public policy. This is from Thrones and Tilford in 1994. In order to give an example to health promotion, a popular example of successful health promotion is the warning label that now exists on cigarettes. Historically, cigarettes were considered socially acceptable and commonly sold without any warning about the risk to the health of the user. However, health experts noted the increased incidence of disease and began to educate the public on the risks of smoking and tobacco use. Eventually, these health promotion activities led to a change in public policy, which now requires the manufacturers to add a warning label directly to the package. And why we need health promotion? Because promotes quality of life, reduces inequalities in health, reduces pressure on services, adds life to year and adds year to life. Health promotion is concerned with making healthier choices, easier choices, and it is cost effective and efficient. If we look at this slide here, and if we focus on individuals, groups and populations, and if we gain strategies like education, counseling, economic change, legislative change, policy or organization change, then the impact will be on behavioral change and social, economic and environmental change, which will bring us to a better health, and in the end, as an outcome, we will achieve an increase in the quality of life. And areas of health promotion activity are health education programs, preventive health services, primary, secondary and tertiary services, community-based work, organization development, health public policy, environmental health measures, and economic and regulatory activities. Now we move on to principles of health promotion. There are 5 key principles put forward by the World Health Organization for health promotion. The first one is health promotion involves the population as a whole in the context of their everyday life, rather than focusing on people at risk from specific diseases. The second is health promotion is directed between sectors beyond healthcare, reflecting the diversity of conditions which influence health. Third, health promotion aims particularly at effective and concrete public participation. This is very important. Without the public participation, you're virtually addressing to no one for a community health promotion and better health achievement. So this requires the further development of problem defining and decision making life skills, both individually and collectively, and the promotion of effective participation mechanisms. The fourth principle of health promotion is that health promotion combines diverse but complementary methods or approaches, including communication, education, legislation, fiscal measures, organizational change, community development, and spontaneous local activities against health hazards. And the fifth principle of health promotion is primarily a societal and political venture and not medical service, although health professionals have an important role in advocating and enabling health promotion. Now we will be talking about healthy public policy. Healthy public policy is clearly desirable, and it should satisfy the following two conditions. The health consequences of different policy options have to be correctly predicted, and the policy process has to be influenced so that health consequences are considered. For example, policies to discourage smoking were initially opposed on the grounds that they would reduce exchequer income and thereby the ability to provide health and welfare services. And this was put forward in 1999 by Prof. But reducing tobacco sales has been opposed on the grounds that it would increase unemployment, but Godfrey et al. Demonstrated that redirecting expenditure from tobacco to other goods was likely to increase employment. And this was given out in 1995 before Pollock. So, number one for healthy public policy. A healthy public policy is characterized by a concern for health and equity and an accountability for health impact. Health should be made a priority item on the agenda of policymakers in all sectors. Policymakers should be made aware of the health consequences of their decisions. They should create pro-health policies, whether in the area of development, legislation, taxation, etc. Two, for a healthy public policy is to create supportive environment. The overall guiding principle is the need to encourage reciprocal maintenance, to take care of each other, our communities, and our natural environment. Supportive environment cover the physical, social, economic, and political environment. Supportive environments encompass where people live, work, and play. All development activities should aim for a healthy environment, healthy buildings, that is to say, healthy buildings, roads, workplaces, homes, surrounding, and schools. Number three for healthy public policy is strengthening community action, community participation. Community participation is a social process whereby groups with shared needs living in a defined geographic area actively pursue identification of their needs, take decisions, and establish mechanisms to meet these needs. Full community participation occurs when communities participate in equal partnership with health professionals as stakeholders in setting the health agenda. At the heart of this process is the empowerment of communities, their ownership and control of their own endeavors and destinies. This requires full and continuous access to information, learning opportunities for health, as well as funding support. Number four for healthy public policy, develop personal skills. Skills which can promote an individual's health include those pertaining to identifying, selecting and applying health options in daily life. Health promotion supports personal and social development through providing information, education for health, and enhancing life skills. By so doing, it increases the options available to people to exercise more control over their own health and over their environments, and to make choices conducive to health. Enabling people to learn throughout life, to prepare themselves for all of its stages, and to cope with chronic illness and injuries. And developing increasing personal health skill information and education for personal and family health, take account of values, beliefs, and customs of the community, continuous process at all stages of life, guided and supported in developing skills, not imposed on them, build on existing knowledge and attitudes. And 5, for healthy public policy, is reorienting health services. Reorienting health services is primarily about the health sector changing from focusing primarily on clinical and creative services to increasingly focus on health promotion and prevention. Healthcare system must be equitable and client-centered. Reorienting health services challenges the medical approach to health, which focuses only on treatments for disease and illness. It recognizes the impacts of all the determinants upon health and views health as more than just absence of disease, but a positive state which should be actively pursued. Some non-health sectors with an input into health promotion can be summarized as education, schools, agriculture, community services, sport, media, non-governmental organizations, the NGOs, the community groups, youth organizations, private sector, legal organizations, public works, housing, water authority, religion like mosques, churches, synagogues, etc., and alternative medicine. Health sectors with an input into health promotion are environmental health, nutrition, community nursing, mental health, dental health, epidemiology centers, hospital, secondary care, school of nursing, and occupational therapy.